Hello, my name is Sarah Jones and this is my presentation on the roles and responsibilities of the midwife. I'll be looking at different areas to cover this, including recent changes and their impact on the roles and responsibilities of the midwife, the impact of the midwife in meeting the physical, social and psychological needs of a woman and her family, the role of the Nursing and Midwifery Council in relation to midwifery practice, the implications of the code on midwifery practice and the role of the midwife, an explanation of the need for effective communication in a multidisciplinary healthcare setting, and finally an evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. Before the 20th century, midwifery wasn't adequately governed. Historically, midwives were mainly mothers themselves. They had no formal training and went by past experiences and information that was often passed down. In the 17th century, midwives were licensed by the Church of England. In 1881, the Trained Midwives Registration Society was set up by Zephyrina Veitch. She was a midwife amongst the poorer families of London. She was helped by Louisa Hubbard, an editor, to help raise standards of midwifery practice. The society was renamed in June 1886 as the Midwives Institute. It became dedicated to midwifery education and training. After many years, their passion was realised with the Midwives Act of 1902 for England and Wales. This led to a central midwives board being established to stop unqualified midwives from practicing. After the Second World War, many women changed from home births to hospital births with the launch of the National Health Service. In 2010, the global standards for midwifery education set a minimum of 3 years' worth of training to qualify. In March 2015, the Chief Executive of NHS England announced a nationwide review of maternity services as part of the NHS 5-year forward view. It was designed to assess current maternity care and services. It's published in 2016. The Better Births report showed improvements had been gained in some areas over the previous decade, like decline in stillborn and neonatal deaths. However, 7 key areas were drawn up to improve upon. Personalised care, to give every woman and baby an individual personalised care plan which allows choice. Continuity of care, implementing the Saving Babies Life Care Bundle to reduce stillbirth, neonatal or maternal deaths by 2030. Better postnatal and perinatal mental health care, to assess the underfunding in these 2 areas which make impacts on the well-being of the woman, baby and family. A payment system, to adequately fund providers for care and safety of the women and babies. Safer care, working alongside other healthcare professionals across different areas with correct leadership across the board. Offering referrals when necessary and any investigations when things don't go to plan. Multi-professional working, breaking any barriers between professionals, allowing for joint training, learning from each other's skills and working across boundaries, encouraging personalisation of services with safety and choice with specialisations when needed. In 2017, the Saving Babies Care Bundle was brought in to reduce stillbirth and early neonatal death. It is composed of 4 elements: reducing smoking in pregnancy, carbon monoxide testing and a referral to a stop smoking service, risk assessment and surveillance for fetal growth restriction, high risk women assessed with ultrasound scans as in line with relevant algorithms, and low risk women observed via antenatal symphysis fundal height charts. Raising awareness of reduced fetal movement, making women aware of the importance of reporting reduced fetal movement (RFM) and ensuring appropriate care is given. Effective fetal monitoring during labour. All staff must be trained to interpret cardiography (CTG) monitoring to detect any abnormalities. Midwives must be trained and assessed every 12 months to ensure competency. During the early stages of pregnancy, the midwife will complete risk assessments to determine what physical, social, and psychological support is needed. These assessments will be carried out for every pregnancy, whether it's the woman's first or not. Extra care or referrals can be made for situations that could arise, such as domestic abuse. The National Institute for Health and Care Excellence, NICE, advised the use of the antenatal assessment tool to evaluate the health and well-being of women and what support should be offered. This normally takes place during the initial booking appointment, so things can be in place from the start. General health will be assessed, including smoking, weight, and BMI, which could lead to an increased risk of miscarriage, gestational diabetes, high blood pressure, and preeclampsia, or venous thromboembolism. Smoking can reduce the amount of oxygen that's passed to the fetus. It can also cause stillbirth, prematurity, and an increased risk of sudden infant death syndrome, SIDS. Women who have previously given birth will be assessed on anything that developed during those pregnancies. Previous episodes of postpartum hemorrhage are at more risk of it repeating too. All previous medical and family history will be taken into consideration. This would pick up any inherited conditions of concern. As labour progresses and the birth becomes nearer, it can be a very exciting time, but also daunting for others. Being prepared can be key to this process being as smooth as possible. The midwife will help women prepare a birthing plan, discussing possible pain relief, what to include in their hospital bag, post-birth care for themselves, and how to care for their newborn. During the third trimester, the midwife will offer women and their partners the opportunity to take part in antenatal classes, which could give them the chance to meet other expectant parents. The midwife will prepare women by explaining signs of labour to look out for and what to do. Knowing who to contact and where to go can help to reassure the women and their partners. A midwife will be there to offer encouragement and advice while overseeing the birthing process, calling for assistance if needed. Following the birth, the new mum will be monitored for the next 6 weeks until care is taken over by the health visitor. The birth itself can be traumatic and the woman will need time to heal. She will be routinely monitored to make sure she's coping with things like sleeping, eating, and any problems with breast or bottle feeding. The midwife will give advice about contraception, tiredness, and any other problems. The midwife will also support the needs of the newborn baby with advice on feeding, sleeping, skincare, and will check the baby's weight. Every newborn is issued with a personal child health record book, PCHR, to monitor development. Advice on correct sleeping positions will reduce any risk of SIDS. At each postnatal appointment, the women's mental health will be checked, making sure they have all the support they need. The midwife will assess for any signs of anxiety and postnatal depression. Women are always encouraged to take time out for themselves, like exercise or a nice bath, to help improve their mental health. The newborn baby will be a major change within the family home and will take some time to get used to. The baby will be totally dependent on its carers for all their needs, and this can be very demanding. The baby's needs of feeding, changing and sleeping will help them develop while they have the security of their carers looking after them, along with extended family and friends. Encouragement will also be given to seek other new parents who can be of support to each other. The Nursing and Midwifery Council, NMC, have been the statutory body for the regulation of midwifery practice since 2002. The three main roles of the NMC are to maintain an up-to-date register of all qualified nurses and midwives within the UK, to set standards needed for education and training and the professional conduct of midwives, to investigate any misconduct and fitness to practice. All qualified midwives must be legally registered. This ensures professional standards are maintained at all times. The NMC control requirements in training which is delivered to students. They approve the education locations with adequate practice placements. They ensure midwives are registered upon completion. The NMC sets the levels of conduct required by midwives, ensuring high levels of competency and performance to delivering the best care possible to the women, babies and families they look after. Giving professional advice and practical support through all stages is paramount to success. Midwives must not practice outside of their skill set and only administer medication they have been fully trained for. All standards must be upheld during antenatal, interpartum and postpartum periods of care. Midwives must demonstrate they are fit to practice in line with all current regulations. The NMC will investigate all allegations made towards anyone on its register. In 2019, the NMC delivered a 5-year programme to support nursing and midwifery. A range of professionals were involved in the study. Unfortunately, when COVID-19 hit the country, this programme, along with others, were either put on hold or postponed. A new strategy is now in place with 3 core parts: regulate, support and influence. This has enabled the NMC to adapt to changes caused by the pandemic. The NMC currently has over 758,000 registered nurses, midwives and nursing associates. Upon registering, you're committing to work in conjunction with everything held within the code, which is helpful in a number of different settings. Service users and their carers can provide feedback. Registered users can promote safe and effective practice at work. Employers can ensure their staff are upholding the regulations. Students can understand what is expected of them once they're registered. There are 4 main parts to the code. Prioritise people. Midwives must make sure the care needs and safety of the user come first. Treat people as equals with respect, giving encouragement and empowerment. Accepting women's decisions on personal care whilst promoting a healthy well-being. Offering the best options available while being open and honest about treatment plans and investigations like blood tests, and only sharing relevant information with other healthcare professionals when safety might be compromised. Practice effectively. Any advice given must be evidence-based with knowledge for safe practice. Use easy to understand language, including any additional help to non-English speaking women and families. Work together with other healthcare professionals honestly to strengthen safety and evaluations. Use any feedback constructively to improve your performance and collect and record data confidentially and accurately. Preserve safety. You must only work within the limits of your training. You must be honest and prompt when any mistakes are made which might affect the well-being of someone. Offering help in an emergency is fine as long as it's within your competency. Any immediate risk must be reported immediately. Anything done against the standards of the code must be reported to. Do everything within your power to practice safely to avoid possible mistakes while following all current legislation. Promote professionalism and trust. You must uphold your professionalism at all times, reflecting in your practice and behaviour. Treat people fairly without discrimination, bullying or harassment. Be aware of your composure around people. Use resources adequately and support your fellow colleagues. Registration to the NMC is compulsory and you must keep up to date with any changes. You must comply with any investigations, respond to any complaints and report any criminal charges. Being part of a multidisciplinary team can bring many benefits to its users. This can only be possible if each person involved demonstrates effective communication. This can be difficult sometimes with people having different levels of training, different work patterns or even different location settings. Lack of effective communication can lead to confusion and misunderstandings with treatment plans and end goals. Developing ways to improve communication skills will vastly increase likelihood outcomes. Sharing knowledge will enable good decision making. Each person needs to know their role so the whole unit fit together like building blocks. Organisations could try using team building activities to improve levels of communication between different healthcare providers. Some MDTs struggle for reasons such as fatigue, stress, distractions, and personal traits. This could lead to conflict. Therefore, it's extremely important for everyone to remember to put the patient first as a priority. Team members should, however, be able to speak out if they feel they are not being listened to. Midwives will work alongside doctors, nurses, and other healthcare professionals needed to oversee the care someone needs and receives. There are many different advantages and disadvantages within a multidisciplinary team. Some of the advantages include the following. It gives the patient access to an entire team of experts. Collaborative support is available from a wide range of healthcare professionals, each person bringing their own skills. Access is therefore available to the best treatment. It improves service coordination. Services are coordinated together in a framework, so it doesn't matter where each service is based. It expedites the referral process. Patients have faster access to specialised help, reducing delays and treatments are accessed earlier, giving a quicker chance of recovery for the patients. It creates new avenues for service implementation, allowing multiple organisations to provide services. It allows patients to create goals for themselves. Regular meetings will allow the patient to be fully involved in their care. The MDT will also encourage family involvement, which could lead to a reduced inpatient stay. Most patients see more progress with an MDT than without. Some of the disadvantages include the following. There is always a time pressure involved in providing services. MDTs work best when everyone is on the same level, but this isn't always possible. An expert in one area is not an expert in every area. Different levels of training and personal opinions will affect the overall picture too. It requires frequent collaboration to be effective. Everyone involved must meet to discuss the patient, which could take up a large portion of time out of their day. This must be done though to ensure collaboration and effective communication. It is dependent upon available resources. Not all recommended treatment plans and resources might be available for the patient, so all services needed can be implemented. Priority is given to those that can be achieved. Incomplete decisions happen without complete information. Information could be missing in certain areas like evaluations, surveys and other data. Without it, the MDTs can't make the best possible choices for the patient. If it wasn't documented, then it didn't happen. All treatments and services must be documented to keep track. MDTs may struggle if dealing with multiple patients requiring different outcomes. Not adequately documenting information could lead to patient harm. In conclusion, MTDs can offer more variety of services to the patient, but it's dependent upon availability. The best results come from everyone working together, bringing their experience and strengths and always putting the patient's needs first. Thank you for watching my presentation.